Hi, this is Dr. Nick Hayward. I'm here with COVID-19 long haul stories. Today, it's Bree's story. Bree, please take us back to how you were before COVID-19 even came along.
Hi, everybody. I'm Bree. I am a certified nursing assistant. I worked in a long-term care facility. I've been an aide for 5 years. I love my job. I love being a caregiver. It's a very rewarding job. I work long hours. I was working 60 plus hours a week before I had COVID. Yeah, a lot of hours. I'm a mom of 3 adult children. I live in upstate New York. Before COVID, I was very active between work and I walked a lot. I went hiking with the kids a lot. I was able to do a lot of things that I can't do now, which is really frustrating for me.
Bree, thank you so much for sharing your background before. It sounds like you've a very active life, looking after other people and children. A lot to do, I'm sure. Take us to the time around when you first became unwell, what was happening and how you became diagnosed with coronavirus COVID-19.
I first was diagnosed in early April. I was working at the long-term care facility, nursing home I worked at. And in the middle of my shift, I spiked a fever, 101.9 fever. So with the new, COVID being so new and their new protocols, they had to have me leave the building. And I had to follow up with the doctors so I could be released to go back to work. When I first went to the doctors, they ran a flu swab, which came back negative. And then they wanted to do a COVID swab, which I was thinking at the time it was so new. I didn't think I had been exposed. We had no cases at work. So I was thinking, no way, but I'll do it, So while I was waiting on my test results, which took a while back then, like about a week or so to get them back, I lost my taste and smell. And this is when I started thinking maybe I really do have it. So sure enough, when they called me, my results were positive. So I did my 2-week quarantine, which was really hard. The isolation and with an unknown virus, that was the hardest part. You're isolated with a virus you know nothing about. And I remember 3 days into my quarantine, I was getting some respiratory symptoms, and I wanted to go to the hospital. Of course, being quarantined, you can't just leave your house and go. So I called the county to see if I could, go to the hospital. And they talked me out of it. They thought it was more anxiety and told me, to just try to relax. And so I didn't end up going. That was frustrating, not being able to go. I had really bad nausea, really bad body aches and pains. I think the nausea was really one of the hardest parts for me. It was really bad. I took Zofran for it, which gave me some relief. The county called me every day. I had to give them my temperature every day. The sheriffs came every day. I had to wave to them out the window and make sure that I was following my quarantine. Not that I would want to go out and expose anyone having it, but they were great though. Like they would drop off stuff on my porch. That was the hard part too, not being able to get your, everyday necessities you need, like toilet paper, drinks, food. So I had to have family drop stuff off on my porch. It was hard not being able to see family too. That was the hard part. Going 2 weeks without seeing family.
Bree, that's fascinating to know how the quarantine was managed in your location. Interestingly, you phrased it in a way that there was some degree of community support, which is great.
Definitely.
And that's unusual because in a lot of communities we haven't really seen that. But can I confirm then, were you isolating in your own home on your own? Was there anyone else around in the home?
I was isolating at home with my roommate, who was presumed positive. She didn't have a test, but because she was exposed to me, they presumed her positive. So she was also under the quarantine. She did develop symptoms. So we were presuming that she had it.
I understand.
So I was then tested. I came back negative so I could return to work. I decided to go to a different facility that was, the whole unit was COVID positive residents. So I thought having COVID, I would be immune to it. I'd be okay. So I went back to work there. It was 3 days into my going back to work that they routinely tested the staff there, and they tested me and they called me a few days later and said that I was positive again, but I had felt fine at the time. So I'm like, what do you mean I'm positive? I feel fine.
So that's quite concerning, because you were unwell for how long initially?
It was a little over 2 weeks the first time.
Okay, so 2 weeks of being unwell, quarantined, isolated, did everything carefully. It sounds like your symptoms went away. Is that fair to say?
Yes, they did.
Great. And that gave you the confidence to go back to work, in fact, into a different facility where there were COVID-19 patients. And surprisingly, here you are, you're positive again. Is that the story?
Yes. So it's like, oh, I have to do another quarantine. It was frustrating. I did develop symptoms again a couple days after my positive test. I didn't have a fever the second time I tested positive, though. My symptoms were a little more mild. I did lose my taste and smell again. I had the nausea and body aches again. They were more mild, however.
Okay, and how long did those slightly milder versions of the symptoms last the second time you tested positive?
It was about 2 weeks the second time.
So another 2-week period. And did you spend those 2 weeks again reasonably isolated at home?
I did. I spent them at home with my roommate again. We were both quarantined.
Okay, and then that's astonishing. So you've tested positive, you've recovered, you've tested negative, you go back to work, you test positive with symptoms again, and then recovered. What happened next?
After that, I was tested again so I could be cleared to go back to work. I tested negative. I went and got the antibody test, which came back positive that I had antibodies to COVID. 3 days later after that, I started feeling unwell again. I lost my taste and smell. Had really, really bad nausea the third time. So I called the county. I'm like, I'm pretty positive I have this again. I know how I feel. I felt this way before. Can I have a test? So they tested me again, and I tested positive again.
My word. So we've had 3 clear separate episodes of you being unwell, testing both positive and then negative. This is unprecedented, because there was this assumption, particularly in the early days, that we were all kind of, thinking about relying on antibody testing as perhaps telling us that we might be immune. But in your case, there's this evidence that, yes, you had developed some antibodies, but you were testing positive and negative in keeping with your symptoms. I think that's a clear message to many, to understand that this isn't something that necessarily just comes and goes and that's it. What are your thoughts on that time period of the positives, the negatives, and that cycle?
I was trying to find like a pattern. I couldn't find any pattern that was going on. Because the third time that I tested positive, I hadn't been back to work yet. So I hadn't been, that I knew of, exposed to anybody again with COVID. And the second time I was pretty sure, being on a COVID unit, that's where I got it from. But the third time, I don't know. And I found it interesting that the third time they didn't mandatory quarantine me. They said I was a residual positive. They didn't think I was contagious anymore. So they didn't quarantine me the third time. But I did choose to self-quarantine because I'm like, I have symptoms. I don't want to risk, spreading it. You just don't know.
It actually sounds like you've been very considerate, careful, and responsible throughout this entire period. So, okay, that was astonishing. Did you recover well after the third time?
I did. I think it was a quicker recovery period the third time, about a week.
Okay, so now the key thing for you, Brie, and I think this is the most important part of your journey, is unfortunately you haven't recovered completely. And in fact, you now have new symptoms that some of your own clinicians believe are likely due to long-haul COVID-19. That's been quite some time for you since you first got diagnosed in April. Could you talk us through what's happened since your acute initial illness?
So in July, I started developing neurological symptoms. My COVID positive and negatives were between April and June. So in July, I started developing the neurological issues. They started with, I had very bad pain in my legs and feet. So one night I couldn't take the pain anymore. I went to the emergency room. They ran a bunch of tests and they said everything's fine, sent me home. So the second time I went to the emergency room, I had numbness on the left side of my face. So I'm thinking stroke, it just made me very nervous. So, and I had numbness in my left arm. So I went to the emergency room. They were thinking maybe Lyme disease. They ran a test that came back negative. They did an MRI to rule out MS. They sent me home. They actually did put me, while they were waiting on the Lyme disease test, they put me on antibiotic for Lyme disease, just in case as a precaution. When it came back negative, they took me off of that. So it was just frustrating not having answers, having all the tests and no answers, no diagnosis, wondering what's going on,
Tell us more about the symptoms of pain in your hands and feet. That sounds quite concerning. Could you maybe describe exactly what happens to your hands and feet, please?
It is. It would keep me up all night. It was so bad. I have like a burning, hot pins and needle feeling in my feet, and it goes up to my knees, and then I get it in my hands. The hands started really bad recently. And then like I'd get really restless legs too at night. And nothing seemed to help the pain. I ice them and that gives me some relief. But so I went to the emergency room for a third time. And the third time I went, they ran a bunch of tests again. And because I had tremors really bad, I developed tremors. And I had tremors really bad for like 2 hours. They were going on. And so the doctor there was very helpful, and he said, well, we think this is essential tremors. Follow up with your doctor, which I did. My doctor put me on a beta blocker to help with the tremors, which was helping at first, but now I started recently to get them again.
Okay, that's astonishing. So you've got quite a large number of neurological symptoms you've described there. Just to summarize, describing these pains in your hands and feet, the tremor, of course, which is movement or shaking, and then at times as well, this numbness in your face. Anything else that you've noticed in terms of your nervous system?
My range of motion, I'll show you this hand. If I try to raise it, this one I can move fine, but the left side, if I try to raise this hand, this is as far as I can go. So I've lost a lot of range of motion in that side of my body.
And I hope you don't mind me asking there, Brie, because it's really, really clear. Does the tremor change as you move your arm higher as well?
It does, as you can see right now, because I'm trying to use it. I'm starting to get the tremors in my hand. The left or the right side is fine. I do get tremors occasionally in my right side, but the left side seems to be more affected now.
And is that tremor in your hands and your feet, or is the tremor more just to do with your arms?
In my arms and my hand. I can feel it like in my voice sometimes. I can feel the tremor, or when they stop, I can feel like a vibration feeling still in my arms.
Wow. And if you don't mind me asking, sort of how many sort of times a day, or how long do these episodes last? Or is it kind of there most of the time for you?
It varies so much. Like I'll have a day where I won't get any at all. But recently it's almost every day. I can't like pinpoint a certain time of day, or I do. Recently I realized like heat triggers them if I'm active. Even walking like up the street, maybe half a block, and I start getting tremors, which is frustrating because I used to be so active, and now, I try to do that and I get the tremors. And also with my foot pain, I can't walk far, even standing too long. Recently, I've started to get really bad redness in my feet if I'm standing too long.
My word, Brie, this is astonishing to see. Now, I have to ask the really important question, if you don't mind. How do your own clinicians feel about this? Do they think it's related to COVID-19?
They think it is. So little is known now about it. So it's just really frustrating to not have a diagnosis. And at first I'm thinking, oh, maybe it's stress. Maybe you're just stressed. That's why you're getting tremors. So it's just frustrating not having answers and not feeling like I was heard at first.
Yeah, I can imagine it's very challenging for everyone because, not feeling heard is terrible as a patient, but for clinicians too, they're sort of trying to make sense of something that is understandably poorly understood at the moment. But I just remember before we started recording this, you did share with me some information that your clinicians have actually been quite thorough in looking for other possibilities. And you mentioned yourself, you've had, for example, an MRI scan of your head to look for any problems directly in your brain, such as multiple sclerosis. Did they look into your immune system at all? I think you mentioned that.
They have, because autoimmune does run in my family. So they did autoimmune testing and that all came back normal.
Okay, so with that in mind, it sounds like, although they're not sure, it sounds like they have actually done a lot of testing for a lot of things and managed to exclude a lot of the obvious causes of the neurological problems. I understand you're undergoing some investigations in the future for small fiber neuropathy. Maybe you could talk us through a little bit about your understanding of that, please.
So at first I had an EMG to see if I had any damage in the large nerves, and that all came back normal. So my most recent neurology appointment, they ordered me a small fiber neuropathy skin biopsy. To test for small fiber neuropathy. And I do that next month. I feel almost positive by the symptoms and everything that I have it. And part of me, I don't want to have it, but I just want a diagnosis. I want to know what's going on so we can treat it, And I worry about, is this always going to be an issue? We just don't know yet. It's so early. Is this going to be a long-term problem? Is this something that's temporary? Is this something that's going to progress? Just not knowing.
Yeah, and that's really important to consider the future. And I'm so sorry that you had this much uncertainty with your symptoms. And for those that might not know, a small fiber neuropathy is essentially the nerve endings in hands and feet have some problem. We often don't fully understand what the problem is. But it's something that's worth looking into for you because it might tell us the explanation for why you have these tremors and the pain, even if it doesn't really give us too much more information as to why it's happening. Is that fair to say? Maybe you could share your understanding of small fiber neuropathy.
I've done a lot of research on it lately, and my symptoms do go along with it. And I am thinking it's something from COVID because before COVID, I was, healthy. I had no issues at all. And for this to come on right afterwards, I'm pretty confident that that's what it's from.
And if you don't mind me saying, Bree, you're in your 30s, is that correct?
Yes, I'm 38. Sorry, I just had a birthday, 38.
No, that's good. Well, I do hope you have a happy birthday.
Thank you.
So, yeah, you're in your 30s, and as far as you've told us, you were not in a high-risk category. You're not someone that was labelled, if you like, at the start of this pandemic as being someone who would be at very high risk. How do you feel about that messaging now you're in the situation you're in?
I feel like even if you're not high risk, everybody has to be cautious and wear your mask. I know there's a big debate about that, but take precautions because COVID doesn't discriminate,
Yeah, I think that's a very clear message. COVID-19 does not discriminate, and it was. I can understand the logic behind sort of trying to manage risk at the start of a pandemic, but it's not universal. And I've said many times that, unfortunately, we all respond differently to this virus, which is extremely challenging. Would you be willing to share a little more about how you feel about the future with regards to getting back to your work or getting back to sort of an ordinary life? Have you any thoughts on that at this time?
I'm really hopeful that I can resume, doing normal day activities, especially going back to work, but just everyday activities, being able to go out with the family and do stuff without having pain in my feet or getting tremors and just feeling generally unwell, being able to do like housework, doing simple tasks around the house, it's really hard now. It takes effort. Taking a shower, like heat really, really brings on my nerve pain. So simple things like that.
Yes, of course. I think that's important for us to recognise. I mean, I said this to you earlier before we started recording, that we take for granted, the ability to use our hands and our feet. Like you said, that was a great example, taking a warm shower and knowing that these day-to-day activities are prohibited by your current circumstances. I'm genuinely sorry to see this. And I must confess, it's something that, like myself as a clinician and other clinicians, we don't quite yet understand. And I'm just so grateful for you highlighting how neurological conditions can indeed occur after COVID-19 as part of the long haul for some patients. Has there been much support from the support groups online? How have you found your access to support so far?
I'm in a couple of support groups and they've been so helpful, just knowing that you're not alone in this, and not that you want other people to be going through this, but knowing that you can relate to somebody else.
Yeah, I think that's key, isn't it? I mean, if we can share our journeys, then somehow that brings a sense of connected relatedness. And I think we are all in this together in different ways. Everyone has their struggles with COVID-19, or even if they don't have the virus themselves, there will be some challenges in their life, undoubtedly. But I think, someone in your situation with this much uncertainty around your health, it's very, very concerning. And I think it's great that there are some out there who can help. And on that topic, how have you found the clinical community? How are the healthcare providers? Have you had good experiences with healthcare providers, or has it been, difficult at different times?
It's been difficult at different times. The hard part is like having my primary and neurology be on the same page, communicating with each other. That's been very difficult. Managing my meds, because one manages one med, one manages the other. So that's been very difficult. Before COVID, I took one vitamin, and now I take so many pills a day. I'll show you. This is like what I take in a week now, and it's just really frustrating.
My word. So that Dosset box you've just shared there, the medication dispenser, that is entirely since COVID-19.
Yes. Before I took a vitamin D supplement, that's it. And now that's everything I take.
And that's interesting because there is research emerging to suggest that if you are topped up with vitamin D, then you may be, staying more likely to be well and less likely to have severe illness with viruses. But again, this is not universal. And although there may be trends, you've just shown that actually, there can be long haul consequences for even people like yourself who look after themselves and were very, very well back in January. Brie, your story is just extraordinary. I feel like it's a privilege to be able to talk to someone who so candidly shares their healthcare concerns. And this has indeed happened very suddenly for you. I'm so sorry to see so many changes so swiftly in literally the space of a few months. Do you have any other messages for society, considering there are some out there that really aren't taking this seriously? Mm-hmm. What would you say to those people out there?
I just want to let them know that we hear so much about like people not surviving COVID, and even if you do survive, like these issues are real. People have not even just neurological, like I have, people have cardiac issues and so many other issues we're seeing now. It's real.
Absolutely. And I think you mentioned earlier the importance of wearing masks, the importance of as you did, quarantining at the right times, really thinking about society in this. And clearly, as your story shows, yes, certain people are at greater risk, but actually everyone can be affected by COVID-19. It's a devastating disease to have as a consequence of coronavirus. Bree, thank you so very much for sharing your story. I would be glad to stay in touch, and I think all I can say is that we really do wish you very well, and are so grateful for your sharing today. I do wish you the best, and thank you once again.
Thank you so much for letting me share.